Before we begin, please type your name into this box. To complete this course, you will need to visit all the sections, answer all the embedded questions, and pass the final assessment with a passing score of 80%. We recommend that learners follow the learning path by moving through the course using the Next and Previous buttons. If at any time you would like to review any section, use the navigation menu located on the right-hand side of the screen. You can change the volume setting by adjusting the speaker icon on the lower left section of the screen. The objective of the course is to ensure that you understand your responsibility and your role in the prevention of tuberculosis transmission. What is tuberculosis? Tuberculosis is an infectious disease that usually attacks the lungs, but can involve other parts of the body. Worldwide TB ranks as a leading cause of death among curable infectious diseases. The World Health Organization estimates that 1/3 of the world's population is infected with TB. While U.S. case rates have declined over the past several years, there are still areas of significant risk of exposure to infected persons in the U.S. Data from 2017 completed. All 50 states reported new cases. TB case rates were highest in California, New York, Texas, and Florida. These 4 states contributed 50% of new cases. Miami-Dade and Broward counties are considered as high-risk communities for exposure due to a number of factors. Number of new cases reported annually, international travelers, high immigrant population, increased elderly population. How is TB transmitted? TB bacteria is spread through the air from one person to another. TB bacteria are put into the air from the lungs of a person with active lung infection by coughing, talking, sneezing, etc. People nearby may breathe these bacteria and become infected. TB bacteria may remain suspended in the air for a short time interval and remain infectious as long as inhalation by another person is possible. The bacteria is able to attach itself to the lung. Community-acquired exposures have been reported from college settings, high schools, correctional institutions, and airplanes. TB is caused by the bacterium Mycobacterium tuberculosis. Primary site of infection is always the lung. However, if active infection occurs, the organism can spread to other parts of the body, bones, brain, etc. There is a difference between just being infected with a TB organism germ called latent infection or having active TB disease when a person is ill and can spread the infection to others. Active versus latent TB infection. Active infection requires immediate medical treatment and isolation measures to reduce transmission to others. Latent infection means the TB germs have been contained by the immune system and the infection cannot be passed to others at this stage. However, certain illnesses or advancing age may weaken the immune system and allow reactivation of the germs to cause active infection.
Tuberculosis, also known as TB, is spread through the air from one person to another. When someone with pulmonary TB disease coughs, TB bacteria are expelled into the air in tiny water droplets. These droplets can remain floating in the air for several hours, making it possible for someone nearby to inhale them. Once a person has breathed in droplets that contain TB bacteria, they travel down the trachea and enter the lungs, where they collect in the alveolar sacs. Once in the alveolar sacs, the bacteria begin to multiply. The body's immune system starts working and macrophages begin to surround the bacteria. A granuloma is formed to keep the bacteria from spreading. The TB bacteria remain in the lungs, but the body is protected from disease by the granuloma. In 8 to 10 weeks, the person will most likely test positive for latent TB infection. The progression from latent TB infection to TB disease occurs when the granuloma break open and the TB bacteria multiply. Then the person becomes sick with TB disease and may be infectious. This progression can occur immediately after infection, many years later, or not at all. When the TB escapes from the granuloma and begins destroying a person's lungs, it's called pulmonary TB. TB bacteria can also enter the bloodstream and travel to other parts of the body, causing extrapulmonary TB.
Review this chart on latent TB versus active TB. TB treatment. Treatment of TB infection depends on whether the infection is active with symptoms or latent, with only a positive skin test or blood test. The infected individual may require more aggressive treatment if there are other conditions present, such as pregnancy, cancer, HIV, or other immune deficiency diseases, or the bacteria is resistant to the usual drugs used for treatment. Treatment will require combinations of medications, and directly observed therapy may be required to assure compliance. Also, vitamin B6 should be given to persons who have nutritional deficiencies, HIV infection, and infants who are breastfeeding or individuals with advanced age. These medications may cause significant side effects, so therapy should be managed by a physician knowledgeable about TB and the required medications. Active TB infection is reportable to public health services. Latent TB is not reported. Healthcare worker safety. The Occupational Safety and Health Administration requires healthcare facilities to provide and enforce an infection control plan to reduce the risk of TB transmission to HCW. That plan must include administrative controls, implementing visitor and isolation policies to minimize the number of staff, other visitors exposed to an infected patient. Environmental controls, through provision of specific air-controlled rooms for infected patients. Respiratory protection, by providing specific masks and training of direct care staff on the use of the masks. Workplace controls, education of all staff regarding the risk of TB and measures to reduce their risk. Monitoring of staff for TB infection status based on risk assessment of the healthcare facility and community. Nicholas Children's Assessment is a low-risk facility in a moderate to high-risk community. Staff monitoring for TB infection. New hires. A quantiferin blood test is used to determine previous TB infection. All new hires, both clinical and non-clinical staff, must have a quantiferin blood test upon hire. Negative TB test reassessment. Reassessment is required for all staff who have work activities at the main hospital and/or the outpatient centers. If your TB test was negative, then you need to get a TB test every other year. Non-clinical staff. Non-clinical staff who do not have work activities with the main hospital or outpatient centers are not required to have TB testing. However, it is strongly advised to do so as risk from community exposure or risk of exposure during travel are still present. Examples: Corporate and Waterford. Active TB infection. Any staff person with suspected active TB infection is not allowed contact with any area of the system until found to be non-infectious. If staff have contact with someone with active TB infection, they should contact the health office and infection prevention for consultation.